I've seen my babies through a camera, and I was able to open it 24/7 and see how my baby's doing, breathing, smiling sometimes, yawning.
Iris connected to her daughter through a baby monitor only. Little Isabella Michelle, still in the hospital, but improving. Iris is now recovering at home, hoping their first official meeting is just days away.
I just hope that I'll be, able to hold her and then just protect her. Once this is over, I just want to spend every second with her and create that bond that we are missing now.
Tonight, as we've been reporting, a terrible toll on African Americans in this country. And in New York City, 34% of coronavirus deaths in the Latino community. For millions of Americans, life on hold. But the message, stay home and stay the course.
It's really about the encouraging signs that we see, but as encouraging as they are, we have not reached the peak.
But still an emergency in so many cities. Today, the Detroit Convention Center turned field hospital now treating COVID patients. The state now taking more drastic steps, banning travel between homes starting tomorrow.
Our most vulnerable citizens are dying in a helpless manner.
In Maryland, the governor warning there are tough days ahead.
We are ramping up the curve. This is going to be one of our most dangerous times ever this weekend and over the next week or so.
But in Florida, which was slower than other states to order restrictions, the governor considering reopening schools in May and saying this.
This particular pandemic is one where I don't think nationwide there's been a single fatality under 25. For whatever reason, it just doesn't seem to threaten, kids.
But the CDC saying at least 8 people under 24 have died in the U.S. States reporting 2 infants, 2 teenagers, and young adults among the victims, like 22-year-old Israel Sows, who died a short time after he and his wife welcomed a new baby. Tonight, the White House confirming the president is creating a task force focused on reopening the country, saying he'll announce early next week members of the medical and business communities will help decide how to move forward.
And I've got to make the biggest decision of my life. And I've only started thinking about that. I mean, I've made a lot of big decisions over my life. You understand that. This is by far the biggest decision of my life because I have to say, okay, let's go. This is what we're going to do.
But on the front lines, the battle continues to save lives. Right here yesterday, we met nurse Mary Kate Finero, working in the same Brooklyn ICU where her father, a physician, was being treated for COVID-19. She was caring for others, not him. Difficult for both.
Unfortunately, I was not ever able to go inside of his room, so I didn't want to cross-contaminate between other COVID-19 patients and him, so I waved to him from outside of the glass.
Today, her dad, Dr. Richard Finero, is out of the hospital, and like so many healthcare workers, jumping back in the fight to beat this virus.
When you were in the ICU and you saw your daughter on the other side of the glass, was there ever a moment you wondered you might not make it?
I had many moments like that. In fact, at least 2 days worth. I just could not breathe. Quite frankly, I was frightened. But on top of that, to see my daughter at the same time was very difficult.
Love to see those stories of recovery. Whit Johnson joins us now. Whit, the president was asked about new federal projections looking at what would happen if stay-at-home orders were lifted after just 30 days. What was his response?
Lindsay, those projections by federal agencies reported by the New York Times would show a dramatic spike in infections if those orders were lifted. The president saying he hasn't seen them, but that he would listen to his medical experts and in the end make his own decision. Lindsay?
Whit Johnson.